Welcome, everybody. My name is Emma. I'm a licensed clinical social worker for those that don't know me. I'm also the manager of the Robert V. Hahn Family Resource Center and the sponsor for this series. So thank you all for coming this evening. We really appreciate it. For those that do not know Center for Enriched Living, or CEL, we've been around since 1968, and we offer services to individuals with intellectual and developmental disabilities. And the age groups that we offer are from basically 13 up. We have a youth program that does a summer camp and also has some afternoon hangouts. And then we have our day program. We have a Catalyst program, which is during the day. It's our life skills program, which is a brand new program that we're starting. So that's super exciting. And then we also have our Reach Day program. And then on the weekends, in addition to our evening program, we also have a number of different weekend programs going out into the community, staying in the center and doing different things, art projects. Really depends upon what the member wants. And so that's the real big thing, the kind of take home for what we do here is we have, an opportunity for people to come here to experience life possibilities. So it just gives a space for any person to come in that, wants to be part of this community that has an IDD diagnosis and get support and be able to live life to the fullest. In addition to our employment program, but my program is also a recent program. We provide mental health services. So myself and Nicole, who's one of our interns, and also one of our Reach staff, are providing mental health services to individuals here at the center, but we're also going to be providing services to the community. So if anybody's interested or has a loved one that needs support, please come talk to me and we can discuss what that looks like. And then we also do resource center appointments. So you can come in, meet with me or Nicole or one of the other interns one-on-one and talk about what you're looking for. One of the reasons we're doing these is to try and help people figure out housing, but housing is not one of the only things that people need, and we recognize that. So figuring out long-term care plans, trusts, different things like that. We're not legal advisors. We can't provide you with legal advice, but we can certainly help point you in the right direction to people who can assist you.
Thank you, Emma. Thank you, CEL, for hosting tonight. And thank you, everyone, for coming out on kind of a gloomy Wednesday evening to listen to me talk about housing. I'm Miranda Martinicky. I am the housing navigator at Community Alternatives Unlimited, CAU. We serve Region B in the state of Illinois, which is considered all of Lake County. We also serve Northwest Cook County suburbs and the northwest half of Chicago. There we go. So, without further ado, what is housing navigation? So, right now, housing navigation is a 2-year pilot program that's launched by the Division of Developmental Disabilities in partnership with the Illinois Council on Developmental Disabilities. Started in July of 2022. So we are well over a year into the pilot, and we have learned a lot over this past year plus so far. And I'm anticipating that there will be even more changes and lessons as we continue through the pilot process. The main goal of the pilot is to assist individuals to find safe and accessible locations to rent in the community. So different from like kind of the more traditional residential type of settings that you might be familiar with. This is intended to be independent living that is separate from a provider agency. My primary activities is to identify individuals interested in independent housing, identify their housing preferences, needs, and desires. We work to cultivate and maintain landlord and affordable housing relationships across various communities. So some of you may be familiar with the statewide referral network. That's something that I can help someone enroll in. And then I also collaborate with private landlords as needed, property managers, things like that. I learn about wait lists for other types of affordable public housing and can help link individuals to that as well, just depending on their need. Let's see. So right now, this is available to individuals who currently receive DD waiver services or have been recently selected from PUNs, essentially invited to start the application process for services. This could be people that want to live alone or with individuals of their choice. That could be roommates, a live-in caregiver, anything like that. Both DD waiver programs right now are able to take advantage of this, whether that be home-based or CELA. And any of those CELAs technically, could potentially be able to take advantage of housing navigation. Moving on. Again, just to kind of recap my duties as a housing navigator, we will start out with assessment. Sometimes this might start out with a person's personal plan. I would definitely encourage independent living to be included in the personal plan if this is the direction that you want to go. And then I will also work with the ISC, the provider, the person, and their family to kind of determine what types of needs they would have specifically in an independent housing setting. We're also going to delve into finances, which we don't always do when we're looking for, some type of housing. But really the financial piece is going to be pivotal in determining what somebody is going to be eligible for. Almost anything affordable is going to be income-based, so we kind of start there and then figure out what types of opportunities might be available. And then, of course, we want to look for the right fit. So once we find a location, I would help with pretty much anything from initial linkage to a property and property manager to touring, helping through the application process, all the way up and through the move. So consider me kind of like another piece of the person's team that will come in, work very intensely with you during the housing location process. And then once they're housed, kind of like the provider and the ISC will go back to being your main contacts. And this is intended to be a collaborative mission. Of course, again, with the person, their family, and the ISC. I'll work very closely with the ISC and service provider throughout the process. And then your ISC will continue to work with you to ensure that services and supports that are needed are in place. That's something that I really like to emphasize, that this is very separate. So I pretty much am in charge of finding the physical structure, and your ISC and service provider, they will be working on the services that are needed to help your loved one be successful in this type of setting. Once transition is completed, again, your identified ISC will continue with just like their quarterly visits as they would before, assess your satisfaction, follow up with the provider, and then if for some reason you need to find different housing or want to find different housing, you can always reinitiate the search with your housing navigator. Okay, so how to enroll in housing navigation if you're interested. The easiest first step is just to call or email your ISC if you have one, ask for housing navigation, and then put it in the personal plan. Yes, I absolutely will. So yes, an ISC is the Independent Service Coordinator. So CAU is considered an independent service coordination agency. We are the agency that you would go to enroll in the PUNS database, to do the pre-admission screening, help you apply for funding, and then we would monitor those services after services are initiated. They are also case managers. I mean, an ISC is technically a case manager. It's just a way to differentiate that role from like the service provider case management role. And I will have a lot more time at the end for questions. All right. And I actually have provided some frequently asked questions because they do come up often. First one. Let's say you're interested in housing navigation, but you are not quite ready to move. That's okay. I would say anytime, if you're ready to look within the next 2+ years, you can start contacting your ISC, talk to the housing navigator. I am tracking individuals who aren't quite ready, but kind of just want consultation to learn a little bit more about it. So I am available for that, just for general questions. And then you can always notify us when you are ready to actively start a housing search. Next one. What if I want to move to a location that's not in my service area? We can pretty much help you find housing anywhere throughout the state of Illinois. That's where housing navigation is. right now, as of today, all of the independent service coordination agencies are participating in housing navigation. So even if, let's say, you initiated with CAU, I helped someone get housed somewhere outside of our service area, there would be another housing navigator that could help assist with any issues that come up throughout the rest of the process after that move. What if my income is too high to qualify for the statewide referral network? That is something that has come up a lot. I think even more than I anticipated when this pilot started. Usually we run into this when there are individuals who are receiving some type of SSI, SSDI benefit, and they're also working. It's kind of a low income threshold to be eligible for SRN. So in that case, we would look into maybe some other subsidized options that have higher income limits. Depending on where they're at, we could even look at affordable market rate, something like that. So you aren't limited only to statewide referral network, although at least for me at CAU, that is usually my starting point, and then we kind of go from there. Is this opportunity available to a family that's seeking housing support? And that's definitely going to be on a case-by-case basis. So I would say possibly, depending on the situation. But this only is going to be applicable to rentals. Housing navigation doesn't help with purchasing any type of home, and it also doesn't pay for rent. And then finally, are any additional funds available? And yes, as of right now, at least for the pilot piece of this, there are transition funds that could be available to individuals on an as-needed basis if there are financial barriers to them being able to move. More frequently asked question. So how will an individual with a disability that's living in a separate apartment in a regular building be supported? Don't they need staff on site? So people receiving housing navigation, it's intended that they're working with a DD service provider that is going to provide the supports needed. Some properties may have an office, they may have on-site management, on-site maintenance, but they really are just there to help with any emergencies that might come up with like the physical building or any unit, just like any typical apartment building. If someone has or needs a live-in staff, this is something that sometimes can be requested through what we call a reasonable accommodation, and that's something your housing navigator could help you with. Lots of people also ask if there's a database that you can look at these different properties or if they're posted. And unfortunately, there isn't. I wish there was. That would make my job a lot easier. But right now, there isn't any type of centralized location that you can find these buildings. The SRN is kind of the closest thing that we have to that. And there is a public-facing side that anyone can look at. But that doesn't necessarily mean that those are going to be the subsidized units available to our population. Let's see. Can the Housing Navigator pilot program be used for a small group? This is something that's been coming up more and more. Technically, yes. It's just that, again, there are a lot more moving pieces that we would have to coordinate to make that work. But technically, there could be a few groups of roommates that maybe wanted to move into the same property. It just depends on when units open up and the timing of that. One thing, though, that this would not apply to are provider-controlled 24-hour CELs. Excuse me. So that would be like a building where the housing and services are bundled together. That isn't something that is part of the housing navigation pilot. I don't anticipate that that's something that this will ever kind of cover, because really one of the central features of navigation is having the service package and the housing be separate. One of the nice things about them, depending, is that if somebody wanted to move, they would not necessarily have to change service providers. If they wanted to change service providers, they could stay where they're living and do that, as long as that new provider was able to provide the supports needed for that person there. All right, a few more. Does the SRN match with housing that's within the budget for individuals or consider the limited income? And yes, I would say SRN is very much looking at individuals with limited income. It's 30% of the area median income or below. So right now that kind of went up back in April. I believe it's just over $23,000 a year of total income. So it is looking at those that are considered like extremely low. This is different than Section 8. It's different than a housing choice voucher. These are specific project-based vouchers, meaning that they are linked to the specific unit, and they are set aside for individuals with various disabilities, not necessarily just DD. Who can receive support from the Housing Navigator program? Again, it could be individuals with IDD, who are either, again, already in service or have been PUN selected and anticipated to be in service sometime soon. And finally, if someone is on the PUNS list and wants to get on the SRN, can the ISC do that for the person? So that's come up a lot as well. And at least right now, that isn't the focus of housing navigation, really just because if someone gets housed and they don't have supports, then we're kind of only doing that halfway. So right now, the focus is on individuals who are either, again, already in or will be. If at some point we're able to expand it, we will let everyone know. That's just not where we're at just yet. And then finally, to address the concern of any type of backup staffing, will there be funds provided for remote support and access to 24-hour provider, backup person? I have not heard of any type of 24-hour backup person, but there is capacity to use different types of remote support, to have someone virtually have some type of support or reasonable accommodation for that. All of the links for that are here. I'd be happy to share my PowerPoint so that you're able to look into that if that's something that you think would be interested. And finally, just in conclusion, and everyone at CAU were very excited to be a part of the housing navigation pilot. Over the year and a half, almost year and a half, we've housed quite a few people who are very happy in their new situation. We're happy to be part of developing new policies and procedures to address this. And of course, because of the nature of a pilot, things are going to constantly be changing as we learn more and people are housed. So what I'm presenting today may be different in a few months from now. It definitely was the last time I presented. And you can always reach out to, again, your independent service coordination agency or to me for any updates about where we are at. And that is it for today. Thank you, everyone.